It may not be the most comfortable topic to talk about, but it's very important that we have this conversation. Many of you high school students here in our state of Michigan may have already participated in your sex education class, but this video is still very important, so please pay close attention. Our focus today is on sexually transmitted infections, more commonly called STIs. Let's begin our discussion by defining these infections. Sexually transmitted infections, as described by the Mayo Clinic, are diseases or infections that are passed from one person to another, generally during sexual activity. These illnesses are usually caused by small organisms, such as bacteria and viruses, that pass through blood, semen, vaginal fluids, along with other types of bodily fluids. You might be thinking, why are STIs important for me to know about? Adolescents, or people aged 15 to 24, account for approximately 10 million cases of sexually transmitted infections each year. Though people your age don't make up the majority of the sexually active population, you are disproportionately affected by sexually transmitted infections. Michigan teens seem to be experiencing even higher rates of sexually transmitted infections. According to the Centers for Disease Control and Prevention, there are higher rates of 3 common sexually transmitted infections, chlamydia, gonorrhea, and syphilis, in our adolescent population here in the state of Michigan when compared to the rest of the United States. This means that as teens here in our state, it's important that you know what these infections are, how they spread, and how to protect yourself from contracting an STI. Some common STIs include chlamydia, gonorrhea, HIV/AIDS, herpes, syphilis, and human papillomavirus. We will discuss all of these infections to inform you of signs, symptoms, and treatments. It is important to understand the dangers of these illnesses, how to prevent them, and how to recognize them if they present themselves. Chlamydia is a sexually transmitted infection caused by a bacterial organism named Chlamydia trachomatis. Many people who have chlamydia don't know it, since it often has no symptoms. People who do not have symptoms can still pass along this bacterial infection to other sexual partners. For those who do have symptoms, they may not appear until weeks after the disease is contracted. These symptoms include discharge from the penis or vagina, burning during urination, and rectal pain and bleeding. If left untreated, chlamydia can have serious damaging effects on the reproductive tract. Females who do not seek treatment can suffer from an inability to get pregnant. Chlamydia can be cured by antibiotics as prescribed by a doctor, but early treatment is vital because damage done to the reproductive tract may be irreversible. Gonorrhea is another common sexually transmitted infection in adolescents, and it can affect both males and females. It is also caused by a bacterial organism. Some men who have the infection do not have any symptoms. Others suffer from burning during urination, discharge from the penis, and pain in the testicles. Most women infected do not have any obvious symptoms. When symptoms show, they are generally mild and overlooked. However, women infected are at risk of other more serious complications. Left untreated, females may develop a condition called pelvic inflammatory disease, or PID, that can lead to chronic pain and infertility. Men can develop a condition causing chronic pain in the testicles and sterility. Gonorrhea can be cured and it will destroy the infection. However, any other damage done will be permanent. It is important to treat this infection early and to follow all instructions given by your medical caregiver. HIV stands for Human Immunodeficiency Virus and is a viral infection that may be passed to others during sex. The virus attacks a person's immune system cells. Over time, when more and more of these cells are destroyed, the body will no longer be able to fight off infections. This leads to a late stage of HIV, where the body is overrun by opportunistic pathogens called AIDS, or acquired immunodeficiency syndrome. Not everyone who has HIV will reach the AIDS stage. Unlike other viruses, once infected with HIV, the body cannot get rid of it completely. HIV is not a curable STI. However, there are treatments that can help manage the disorder. These treatments are cocktails of drugs called antiretroviral therapy and can prolong the lives of people with HIV. Genital herpes is an STI caused by the herpes simplex virus. It is a very common disease, and according to the CDC, 1 out of every 6 people aged 14 to 49 will have genital herpes. Most people who have the infections have no symptoms or very mild symptoms, and it is often mistaken for other types of skin conditions. In cases with obvious symptoms, sores will appear in the genital regions. These blisters become sores and can spread to other regions of the body. These sores can often take weeks to heal. These blisters come in sporadic outbreaks. Repeat outbreaks are very common. There is no cure for genital herpes. However, there are treatments available to prevent or shorten sores and outbreaks. Syphilis, another sexually transmitted infection, is easily curable if properly taken care of, but can have very dangerous complications when left untreated. Symptoms of syphilis are divided into 4 stages: primary, secondary, latent, and late. Primary syphilis is marked by the presence of a single sore on the spot where the infection was passed. This sore can last weeks or even months. Secondary syphilis is marked by a rash several weeks after the first sore has healed. Other symptoms may also be present. This stage, regardless of treatment, will go away. The latent stage begins when all earlier symptoms have disappeared. Though there are no obvious signs of disease, syphilis will still persist in your body and can still be passed on to other sexual partners. Late-stage syphilis may not appear for 10 to 30 years after initial infection, but is very serious and marks damage done to other organ systems. Late-stage symptoms include lack of coordination, paralysis, blindness, dementia, neurological problems, and can result in death. Syphilis can be cured by antibiotics, but any damage done to other organs is irreversible. It is important to seek treatment as soon as one becomes aware of a syphilis infection. Human papillomavirus, more commonly called HPV, is one of the most common sexually transmitted infections. According to the CDC, it is so common that nearly all sexually active men and women will get HPV at some point during their lifetime. There are many different forms of the virus, some causing genital warts and others causing cancers. Some forms will go away on their own, while those causing the warts and cancers generally do not. Genital warts generally appear as bumps in the genital regions. Other forms of the virus lead to cancers, including cervical cancer, vaginal cancer, penile cancer, and cancer of the anus. There are no treatments that directly eradicate the virus itself from the body, but there are treatments for symptoms such as genital warts. There is a vaccine available to prevent HPV infections that can protect both men and women from the warts and cancers caused by HPV. The vaccine is safe and effective and recommended for all boys and girls starting at age 11 through the age of 26. The next part of our conversation will discuss how sexually transmitted infections are passed from one individual to another. We will also clear up some common misconceptions about STIs. If you have any questions about any of the information that we have talked about so far, please ask your teacher to pause this video and feel free to ask them any questions that you may have. There is a common misconception, especially in the teenage population, that the only way to get a sexually transmitted infection is by having vaginal sex. However, this is not true. STIs can pass from one person to another through a range of different sexual or romantic acts. On the screen, you will see a list of activities that allow for the spread of sexually transmitted infections. These include having oral sex, vaginal sex, and anal sex with someone infected with the sexually transmitted infections. Some STIs may also be passed from mother to child during birth. Another common misconception about sexually transmitted infections is that you can only pass them along if you're currently showing symptoms. For example, I can only pass on genital herpes if I'm currently having an outbreak. However, this myth is very untrue. In fact, even if you have diseases like genital herpes or syphilis, where symptoms are not always very common, you can still pass along the disease to other people. We're now going to talk about different ways to protect yourself from getting a sexually transmitted infection. If you have any questions about anything that we've talked about so far, please feel free to stop your teacher and ask any questions that you may have. On the screen, you'll see a list of common forms of contraception. Contraception is a means of protecting yourself from both unintended pregnancy as well as sexually transmitted infections. For our discussion here today, we will talk about the most common forms of contraception. If you have any questions about other forms, please feel free to ask your instructor. The first method of contraception we are going to talk about is abstinence. According to Planned Parenthood, abstinence is defined as not participating in any kind of sex play with a partner. There is some confusion about what abstinence really means. We will clear this up. Some people feel that practicing abstinence means not participating in vaginal sex. This is complicating because, as we talked about earlier in this video, sexually transmitted infections can be passed on in other ways, such as oral and anal sex. For abstinence to be most effective, people practicing should not participate in any vaginal, oral, or anal sexual acts. Abstinence is the only method of contraception that is 100% effective at preventing sexually transmitted infections, when properly practiced. It is also the safest way to prevent sexually transmitted infections as it does not have any hormonal side effects. This is also a free method of contraception. Anyone can choose to be abstinent, even if you have previously participated in any form of sexual activity. Abstinence is not just for people who have not yet had sex. If you have questions or would like more information on abstinence, you can talk with your instructor or you can visit PlannedParenthood.org. You can find the link at the end of this presentation. Condoms are another common form of pregnancy and STI prevention. Condoms are what we call barrier protection because they form a physical separation between the penis, vagina, and any fluids or skin that could transmit sexually transmitted infections. Condoms are rolled onto the penis before having sex and are not removed until the sexual activity is done. They are a one-time use contraceptive and should never be reused. A new condom should be opened each time you have sex. Before using the condom, you should check the package's expiration date. Do not use a condom that is expired. Only one condom should be worn at a time. Wearing multiple condoms does not make them more effective. If worn correctly every time, condoms are 99% effective at preventing pregnancy and sexually transmitted infections. Planned Parenthood estimates that they are probably about 82% effective when not worn correctly every time you have sex. Please follow this link to watch a video about the proper way to use a condom. This video is very informative and was produced by Planned Parenthood. It shows a fantastic demonstration of the proper way to use a condom when you are having sex. If you are considering having sex or if you are currently having sex, it is important to be prepared. Anyone, male, female, of any sexual orientation can purchase condoms. Condoms can be purchased almost anywhere. They can be purchased at drugstores like CVS, Rite Aid, and Walgreens, as well as at major grocery stores like Walmart, Meijer, and Kmart. You can also find them at gas stations, as well as online. Condoms are generally priced at about $1 a piece, but can be bought in bulk. If you are having sex, you should always have condoms available, and you should discuss condoms with your partner. Some places hand out condoms for free. These are usually doctor's offices, Planned Parenthood centers, and local health departments. All of these places are judge-free zones. For more information on where to get condoms in your area, please consult your teacher. On the screen, you will see a list of birth control options that are for females. These include pills, a shot, a birth control patch, an implant, and a vaginal ring. All of these options vary in cost, and they all require a prescription from a doctor. Pills range anywhere from $0 to $50 every month and must be taken on a strict schedule. The shot, also known as Depo-Provera, is given to females every 3 months and costs anywhere from $10 to $100. Birth control also comes in a patch, and this patch sticks onto a woman's skin. These are generally replaced monthly and cost anywhere from $0 to $80 each month. The implant form of birth control is a little more invasive, but it also lasts longer. The implant is a small rod that is inserted into a woman's arms, and it works to prevent pregnancy. This is inserted by a doctor and can cost up to $800. Another female-based birth control method is the vaginal ring. These are small rings that are placed inside the vagina each month and are easy to get with a prescription. These can cost anywhere from $0 to $80 per month. The last form that we will discuss is an IUD, or an intrauterine device. An IUD is a small T-shaped device that is placed in a woman's uterus. An IUD is very effective at preventing pregnancy and can last up to 12 years. These generally cost anywhere from $0 to $1,000. Many of these birth controls use hormones to prevent pregnancy, and these do carry side effects, such as nausea, cramping, and spotting between periods. What are the other disadvantages? Think about what we have already talked about today. None of these contraceptive methods that we just talked about prevent the spread of sexually transmitted infections. They do not form barriers, like a condom does, between sexual organs. They do not prevent contact with potentially infected skin or fluids. While they are very effective at preventing pregnancy, we must also think about STIs. It is important to keep this in mind when thinking of sex and the best ways to protect yourself. According to the Guttmacher Institute, people your age, including you guys, who may be sexually active, are at the highest risk of both getting a sexually transmitted infection and at having an unintended pregnancy. So far, we've talked about different ways to prevent these things. However, the most effective way of preventing pregnancy may not be the best way to prevent an STI. In order to protect yourself from both of these situations to the best of your ability, you should consider combining some of these contraceptive methods that we've talked about. For example, condoms provide effective protection for STIs, and combined with birth control pills, both you and your partner can be safe from having an unintended pregnancy. The next few slides show some combinations of contraceptive methods that you can use if you are sexually active or if you're considering becoming sexually active. You should discuss these with your partner. As we go through these examples, please ask your teacher any questions that you may have. Sex, sexually transmitted infections, and protection are all very complicated and confusing subjects. You will likely have questions and you may feel too embarrassed to ask them, but you should know that there are people you can talk to, judgment-free. Let's start with your teacher. You can talk to your health teacher anytime to ask any questions you may have. Remember, your teacher is dedicated to making sure that if you choose to be sexually active, you have a positive and safe experience. Your doctor is another great resource. Doctors go through very long educations and they're experts on sexual health and sexually transmitted infections. You can make an appointment anytime or call your doctor's office to talk about sex and to ask any questions that you may have. If you have a local health department in the area, they'll also have people you can talk to. Another great resource is Planned Parenthood, where they have experts that are willing to talk to you anytime. Parents. Talking about sex with your parents doesn't seem like an easy thing to do, but your parents care about you very much and they want you to be safe. You might be surprised with the information and advice they can give you. Remember, they were your age once. You may want their advice on if you are ready to have sex, how to access contraceptives, or what to do if you do get an STI. Starting a conversation about sex with your parents might be the hardest part. Here are some tips to help you get the conversation going. Give your parents a heads up that you want to talk so they're not caught off guard. Tell them you're nervous right off the bat. They probably are too. Write down all of your questions before you sit down with your parents. This way, you won't forget something important. You can also start talking to your parents by text messages or over the phone. It might be easier to start the conversation there and continue it in person. Having sex or sexual relations is a very personal and intimate thing that happens between two people. If you decide to participate in sexual play with someone, you need to talk to them. It's important to tell each other your feelings and to communicate your expectations. It is also extremely important to talk about protection before you engage in sex. Tell your partner what types of protection you would like to use. If a potential partner has never heard of them, you can help them understand what they are and how they can protect the both of you. If your partner is unwilling or rude and does not want to meet your expectations, it's a good indicator that you should not be sexually active with that person. Remember, communication in sexual relationships is key, and your voice matters. On the screen, you will see a few web pages and groups that you can access to learn more about sex, sexually transmitted infections, and contraception. The Centers for Disease Control and Prevention has a huge selection of web pages available online that will cover these topics. Planned Parenthood is another great resource for you. Their website offers detailed explanations on sexually transmitted infections and contraceptives. You will also find explanatory videos and information on how to talk about sex with your parents. Finally, the Advocates for Youth group also has a wealth of information available online. We live in a very tech-savvy world, and the internet is a great place for you to research your questions about sex. Just be careful. There is some scary stuff on the internet and not everything's true. Make sure the websites you're looking at are reputable and have very good information. We've covered a lot of material today about sex, sexually transmitted infections, and contraception. To wrap up our discussion, let's do a little bit of review. We started our conversation with the definition of STIs, also known as sexually transmitted infections. These are diseases or infections that are passed from one person to another during sexual activity. These infections can have very serious consequences, and not all can be cured. A few examples of these include HIV, syphilis, gonorrhea, chlamydia, and genital herpes. These can be passed from one person to another during unprotected sexual acts, including anal, vaginal, and oral sex. Remember, people your age are at a high risk of contracting a sexually transmitted infection. Contraceptives are devices or objects that can be used to prevent STIs as well as unintended pregnancies. Most people think of contraception, sometimes called birth control, as only useful for preventing pregnancy, but they're very important in protecting yourself from STIs. Abstinence, which means not participating in any form of sexual activity, is the only method of contraception that is 100% effective at preventing STIs and pregnancy. Anyone, even if they have previously had sex, can practice abstinence. Condoms are another very important contraceptive. They are put on a male's penis before engaging in any form of sex and not removed until the act is over. They form a physical barrier, when used properly, that protects against the spread of STIs and against pregnancy. For more information and demonstrations, please see the earlier parts of this video. There are other options such as pills or shots that are taken by women, but they do not protect against STIs. The best outcomes come when you combine a few of these, such as using condoms as well as birth control pills. There are many resources available to you if you have any questions about any of the things we've talked about. You can talk to your health teacher, your doctors, staff at the local health department, and your parents about your questions and concerns regarding sex and sexually transmitted infections. You should not feel embarrassed if you have questions. This is a very confusing and emotional topic. All of these people care about you and want you to have a safe and positive sexual experience, should you choose to do so. You can also access information on the web. The CDC, Planned Parenthood, and Advocates for Youth all have great information for you to browse. When researching on the web, please be careful. Not all sites have correct information. Thank you for watching and engaging in this uncomfortable yet very important discussion. Sex is a big responsibility, and it's important that you understand the risks before you engage. If you have any questions, comments, or concerns, please take the time to ask your instructor now that our time together is ending. I hope that you keep all of what we talked about in your mind as you make decisions about your future sex life.